Greetings, everybody. I am Anuja Purohit from Beautiful Spotless Skin Team. I hope all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. These patches seem like freckle like structures. They form a flat and a brown colored pigmented area over our skin. So this is nothing but melasma. And in simple terms, melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities revealed that more than 80% of the population present skin color heterogeneity irrespective of age and gender. This heterogeneity mainly results from hyperpigmented areas, hyperpigmented spots and melasma. Indian skin tone is more susceptible to pigmentary disorders and it occurs majorly in 90% of women and 10% of males of all ethnic and racial groups, and around 20 to 30% of 40 to 65-year-old women present a facial melasma. So, why is it necessary to discuss about melasma? So, melasma and hyperpigmentation generally they are ignored as a sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue, and this can lead to frustrating setbacks in treatment of melasma. So, to avoid all these hassles and to keep you informed, today we are here to know more about management of melasma from our expert dermatologist. So, Dr. Malini Patil has joined today in our session to discuss more about melasma. Welcome, Dr. Malini Patil.
Thank you so much, Anuja.
So, viewers, Dr. Malini Patil is a seasoned dermatologist, cosmetologist, and trichologist with a distinguished career spanning over 18 years. A graduate of Shade GS Medical College and King Edward Memorial Hospital, she completed her MBBS in 1998 and a diploma in venereology and dermatology in 2001. Dr. Malini Patil has held key roles including consultant dermatologist at Kaya Skin Clinic and associate dermatologist at Leelavati Hospital and Research Center. Dr. Malini Patil specializes in managing a diverse spectrum of dermatological conditions ranging from common conditions like acne, melasma, and psoriasis to more complex cases such as vitiligo and autoimmune cutaneous diseases. Her expertise spans both clinical and cosmetic dermatology, allowing her to provide holistic care to her patients. And she is also the founder of Skin for You Clinic and Aesthetic Body and Wellness Clinic. So, welcome, Dr. Malini Patil.
Thank you. Thank you,
Ma'am, today
everyone.
we are privileged to have you with us. And now, viewers, Dr. Malini will be sharing insights on melasma and its management. We extend our heartfelt gratitude to you, Doctor, for joining us. And without further ado, over to you. Let's start with what is melasma and how it's formed.
Melasma is basically, as you had mentioned earlier in your introduction, it is a very common skin condition wherein there are black spots which come in as freckles or dark patches on the face. It usually starts on the cheeks. It can go to the forehead, on the upper lip, nose, on entire face as well. Now, melasma is a condition which is little genetic. It has a genetic inheritance, and it is because of increased melanin production in the skin. Now, this increased melanin production is because of various reasons. There are reasons like basically hormones is the major important reason. The estrogen and progesterone which are there in our blood, that can trigger the melasma production, increase melanin production and cause melasma. So oral contraceptive pills or drugs which have these hormonal components can trigger melasma. Sun exposure is one most vital reason which increases pigmentation of the skin. So sun exposure should be avoided. And third and most important is stress. So any kind of stress, physical, mental stress, physical stress, oxidative stress, can trigger this melanin production in our body, and thereby increase the melasma.
Okay. So, are there any major causes for prevalence of melasma in women more than males?
Because women have estrogen and progesterone.
Hmm.
That those are female hormones, and those
Yes.
are the main reason for trigger of melasma.
Okay.
Okay, so that is why we see during pregnancy or after pregnancy, whenever there are hormonal disturbances in a body, melasma can erupt.
Okay. So, any other age-related predisposition in women, like younger women are less susceptible to having melasma as compared to females having pregnancy or any hormonal imbalance, something like that?
Yes, if patients have hormonal imbalance post pregnancy, post any disturbances in the hormones, like taking oral contraceptives,
Hmm.
that can predispose a person to melasma.
Okay.
So, whenever a patient of melasma comes to us, we tell them to avoid taking oral contraceptives and to use some other kind of contraception, so that the melasma does not increase.
Okay. So one reason of melasma being so much predominant in women is hormonal imbalance or any other things related to oral contraceptives or any other things.
Yes,
What about melasma in males? Because they don't have such hormonal imbalance thing as compared to women. So what are the reasons of melasma being predominant in 10%, but this is also a large
yes,
number. So, what
yes.
are the reasons of melasma in males?
See, normally also every female has little bit of male hormone, testosterone, and every male has little bit of female hormone, that is estrogen. So, any imbalance between the male and the female hormones can trigger melasma.
Okay,
So, so for men also it remains the same, hormonal. So,
right.
increase in the estrogen production can cause melasma in males also. And
Okay,
also, we should not forget genetic predominance and sun exposure and the other factors which trigger
okay,
melasma.
yes. So, initially I said that melasma and hyperpigmentation, both these conditions are ignored skin conditions. So, is there any difference between these two, or they are the same?
Mm. No, there is a big difference between melasma and hyperpigmentation. Now,
Mhm.
hyperpigmentation is just because of increased melanin production, and it could be because due to reasons like post acne or post infections or post any rashes which have come on the body. They can leave a dark mark. Okay,
Yes.
so that is hyperpigmentation. That is easily treatable with creams, with lasers, and they can be gone totally, completely, without
Okay.
chance of recurrence in that particular area or because of that cause. But
Right.
if there is melasma, it is very difficult to treat because it has a genetic reason and it has a hormonal reason. So melasma is totally different and hyperpigmentation is totally different.
Right. Okay.
The
So,
reason for production of melasma is different. It is it stimulate the genes are stimulated and there is tyrosinase activity which is increased. So the reason for melasma is little different from hyperpigmentation.
course, yes. Okay. So, are there any signs and symptoms of melasma? Like, can we predict from some signs and symptoms that melasma is increasing, or we are having melasma, we are growing, we are having brown patches, or what?
Mm, of course, melasma normally, if you, it is seen on the face. Melasma is pigmentation, it is seen on the face. You start seeing freckles, you start seeing dark patches. That is when you come to know that it is melasma.
Mhm.
Before the dark patches come, there is no predilection factor as such that which can give you an indication that you might get melasma.
Okay.
Okay. Now, if a person's mother or close relative, as in sister, has melasma, there are higher chances of that person getting melasma. But that does not give a guarantee that that person will definitely get melasma. So there are other risk factors also which are associated.
Okay. So, you said that generally we see melasma on face. There is facial melasma. So, are there
Right.
any specific sites on our face that are more prone to develop melasma?
Yes. There are these malar areas. This malar area is the nose, then forehead, and on the cheeks, around the jawline also you can get upper lip. So basically everywhere, but first it starts on the cheeks, on the malar areas and the nose.
All right. Okay. So, why do we discuss about melasma? Why there is a need to discuss about melasma? What are the risk factors associated with such skin condition?
See, why do we discuss this? Because it is very emotionally disturbing to the patient. It is very difficult to treat. It is a very because there is no cure for melasma because there is a genetic inheritance, so there is no total cure. But definitely we can decrease it with the treatments that are available in our kitty. So mela- the only problem with melasma is it is emotionally very disturbing to the patient.
Of
Having
course.
black spots in the face
Yes,
becomes
patient
little
may lose
difficult.
confidence, or socially unacceptable conditions may arise when severe cases of melasma we see.
Yes, because whenever a patient of melasma goes outside, goes in, travels in the train or goes to any function, then everyone has advice, free advice that why don't you do something? What happened to your face? What, you are not doing anything to your face. Do something, go to a doctor, do this, do that, and then they will give you DIY. Lots of things, free advice will be available. And that becomes more disturbing to the patient. Someone telling them about it,
Of course.
pointing
So,
out the fire pattern.
diagnosis of melasma. How do you diagnose melasma?
See, diagnosis is once we see a patient, we can easily make out that this is melasma. But Wood's lamp, there is something known as Wood's lamp. That instrument also can diagnose whether it is epidermal melasma or dermal melasma or mixed melasma. So, epidermal melasma is very easy. It can go off. With the treatments and the cleans and everything. Dermal melasma, it is little difficult to treat, and in most of the patients in by the time they come to us, by the time they come to a doctor, it is already a mixed melasma. So there is an epidermal component and there is a dermal component. So dermal means it has gone inside, so it
Yes.
becomes
It's
little
deeper.
difficult, deeper into the skin. So it is little difficult to treat,
Okay.
though we
So,
have
are
lasers and
there other types
everything
of
now.
melasma? You told us about epidermal and dermal melasma. So, are there any other types of melasma also?
No, there is mixed melasma.
Okay. So,
Mixed
epidermal, dermal, and mixed
means
melasma.
there is a epidermal component also and dermal component also.
Right. So, according to the type of melasma, does the treatment plan also vary?
Yes, little bit, not much, not
So, how
much.
do you
Because
treat melasma? All kind of melasma. How do you treat that?
so basically, first we counsel the patient because it is a very difficult condition to treat. So first is counseling. We tell them that this is melasma. We tell them the reasons why it is happening, and we there are certain tablets and creams which are available now which can decrease the melasma. And the most important thing is about sun exposure. We have to, I usually in my practice tell patients to use sunscreen regularly, a very good sunscreen, physical sunscreen, and one has to use it every 2 hourly so that the risk of sun exposure leading to or increasing melasma is taken care of.
Right.
Also there is a reason for of stress, so we have to give something for the stress as well, so antioxidants.
Okay.
And to take care of the hormonal aspect of melasma, there is something known as tranexamic acid which is given for melasma.
So one of our viewers has question regarding to this topic. Meenal is asking, how does UV radiation cause melasma?
See, basically, UV radiation, any kind of radiation, UV radiation, UVA, B, that will help in, that causes triggering of melanin production. And whenever there is melanin production, it is going to increase melasma. Also, whenever there is sun exposure, there are release of free oxygen radicals. And free oxygen radicals can disrupt our DNA and then cause trigger the DNA aspect of melasma, like in the gene aspect of melasma.
Okay.
So sunscreen is that important. Mhm.
So we always say that prevention is better than cure. So
Yes.
in case of melasma, how can we prevent development of melasma?
Uh, I usually tell my patients is whatever is in our hands, we have to do it. So if we know that sun exposure is going to trigger or increase our melasma, so then we have to take care of that aspect. So sunscreen should be used religiously. How you brush your teeth, how you get up daily, take bath. Similarly, you have to use a sunscreen. So after bath, first thing is you have to take your care of your skin using a face wash, a cream, a sunscreen. Okay. Now, if any person is going out or staying out in the sun for long hours, then every 2 hours one has to use a sunscreen.
Okay, every
So
2 hours, right?
every 2 hourly, because that is going to give them the protection from the UV rays.
Right, right. Okay. So one more question is from our viewer Firoz Khan. Are
Mhm.
women with darker skin more prone to melasma?
No, no, it is not like that. Otherwise, all dark females would have had melasma. It is not like that. Mhm.
So, are there any home remedies that we can use to prevent melasma or to cure melasma if it's in a very initial stage?
Um, Normally, I wouldn't suggest because there are many things that are available on the internet, on Insta, on Facebook that use lemon and then that will decrease your melasma, or use tomato juice and that will cause melasma. Now, that will decrease the melasma. But what happens is when you use these acidic products on the face, then it can cause an adverse effect and it can trigger the melasma as well.
Oh,
So I would suggest not to use DIY creams or anything. Just using a good face wash, moisturizer, and sunscreen. That should be your thing to do.
fine. The
Nothing else.
basic line of treatment for every skin problem nowadays. I mean, I consider that a very basic line of treatment that we use a very good face wash, moisturizer, and sunscreen. So that will, I guess,
Yes.
prevent many of our skin diseases. Is that true? What I believe?
True, true. Not many, yeah, but at least
Yeah,
it will keep your skin healthy.
of course.
Yeah,
Okay.
right.
One more viewer is asking, Sheila Agrawal, can certain occupation increase melasma risk?
Yes, if anyone is in working in a heated environment, in solar, wherever there is solar radiation or any kind of radiation, that can trigger, that can increase their risk of getting melasma.
Okay. And
So,
of course, stress related factor, I guess that's the most
oh,
common factor
that
of any small disease also nowadays
true,
in day-to-day life.
true, true. Stress remains one of the most important factor.
Yes,
I
of
have
course.
seen that during COVID, there were certain females who were housewives, but they started getting melasma, and
Oh,
there were certain females who were working, and when they stayed home, their melasma disappeared.
oh,
So, so
very
you can never know. You can never know what can trigger your melasma.
course. So factors vary according to person or
Very,
according to the environment we live in or work in.
very true. Very true.
Okay. One more viewer, Yash Namdev, is asking, how does melasma affect the forehead?
Similar way how it affects the malar area. See, forehead skin is very thin.
Hmm.
Okay. So whenever UV rays fall on that area, it will, there is lot of, there is chances of pigmentation. And if that patient is prone to melasma, then it will cause melasma pigmentation over there.
Okay. Can
Hmm.
any certain skin type is prone to having melasma, like sensitive skin or normal or very dry skin?
Dry skin can, very
Okay.
dry skin can, definitely. Sensitive, as in if a person is going out in the sun and his skin is burning a lot.
Mm-hmm.
Okay, so
Right.
then it should give you an indication that you have to use sunscreen very religiously, because it will not tell you that whether you will get melasma or not, but definitely you will get a lot of tanning.
Yes.
Okay, or sunburn. So
Okay.
one has to think about that as well.
Okay. Deepak Saxena is asking, can melasma cause any itching or irritation?
No, melasma does not cause itching or irritation, but the creams that are used for melasma that can cause itching and irritation.
Okay. Right.
Hmm.
Okay. So how can we prevent that or how can we treat that?
Yes, basically, see, melasma is a condition in which you don't feel anything; it is just seen.
Yes.
Okay. Now there are people who go over the counter and take medicines. अरे मुझे वहाँ ये हुआ है, pigmentation हुआ है, तो मुझे कुछ तो ट्यूब दो.
Yes.
Pharmacy, the pharmacist will give them some tube. Now the patient doesn't know what that pharmacist has given him. So
Yes.
it could have a steroid, it could have retinol in it. Okay, so now what happens is when the patient uses, it decreases, but then it causes irritation as well.
Okay.
Okay, it causes dryness, excessive dryness. So whenever that person is washing his face or going out, it becomes more sensitive. The skin becomes more sensitive.
Okay.
So
Is there
one
is
has to avoid
okay.
using over the counter creams.
Yes. Yes. Okay. So, as you said, there are also some misinformation, misconception about melasma and hyperpigmentation. So, please enlighten us about that one by one. Any myths or misconception regarding to melasma and
You tell me
hyperpigmentation?
what are the myths. I will tell you if it is a myth or not.
Okay. So, one is this, that melasma is just an age-related problem and उसका कुछ नहीं करना है, nothing to do with it. So, can it be dangerous if not treated?
It is not dangerous.
Okay.
It is, this is a condition which is not dangerous, but it is emotionally very disturbing. People feel hopeless, and they don't feel good about themselves when they look in the mirror.
Mm-hmm.
Okay, so
Right.
then their quality of life decreases, and they don't socialize well. So that is the most important thing. So
Right.
mentally, they become very depressed.
Of course. Okay. So, can using frequent makeup products or beauty treatments increase melasma or decrease melasma? Does it have any effect?
No, it does not have effect. See,
Okay.
normally one can use makeup to hide melasma, but
Yes.
makeup will not cause melasma.
Okay. Can melasma turn into cancer?
Melasma, no, not usually. But see, whenever one has melasma, that means their skin is sensitive towards the sunlight.
Okay.
Okay, so if a person is exposed to a lot of sunlight, or they are working only outdoors, usually in Indian people, skin cancers is less, though now it is increasing because of the ozone layer being depleted and the UV rays are coming more.
Hmm.
So the incidence of skin cancer is more. But if you say if melasma triggers skin cancer, no, it doesn't trigger skin cancer, but it
Okay.
just tells you that you are sensitive towards sunlight.
Right. Okay. Uh, is melasma due to some allergy or infection, Or can melasma be a bed to develop allergy or infection?
No,
Okay,
it's a myth. It's a myth.
right. So melasma isn't infectious in any ways.
No way, no way, no.
All right. As you said, melasma is a genetic disorder, hereditary disorder. So, is there any treatment or is there any cure to it? Because it's a genetic problem, and it is not like every generation, every offspring has melasma. But can it be cured if our ancestors have this?
Currently, there is no gene therapy for melasma as such. I don't think it is in their even in their thoughts as yet. The scientists, but uh, but one, if someone has melasma, they should not get into all these things. Now it has come. Okay. Now the melasma is there on your face. So you have to get it treated. You have to do
Yes,
something about it, something which will make you feel happy about yourself.
of course.
Okay. Um, so I would suggest patients who have this melasma not to go back and think, oh, my mother had melasma or my sister has melasma. I might or I will definitely get melasma. It is not like that. Every person is different.
Hmm.
Okay. Not because your ancestors have melasma, you will also get melasma. No, it is not like that. Okay. There are other risk factors as well, so we can take care of those risk factors and leave the genes, whatever are there, in the back of our mind,
Okay.
not to
So
think
first
much.
is acceptance that okay, this is the condition, and then we have to think about its treatment and its management.
Right, right, right.
Can melasma be permanently cured?
Um, there is no permanent cure for melasma,
Hmm.
but it can be definitely decreased. Um, Also, we have seen in certain cases that once the hormonal imbalances which are going on in the body, that decreases the melasma as well.
Okay.
Hmm.
So is melasma permanent? Means if we get patches, it's always there and it will
No, it
stay
is
with
not.
us forever.
It is not always there. There are ups and downs. One can see that whenever they go out in the sun, the pigmentation increases, the darkening increases. When they are indoors, it decreases. Whenever they are feeling good about themselves, it decreases. When they are feeling very depressed, mentally not in their best of health, it increases. So, all these factors are also there in melasma. And with
Right.
treatment, we try to decrease the intensity of melasma such that it is not easily visible.
Okay.
So that much we can achieve, but we cannot take it out from your body because it is there in the gene, always remains. So we cannot take it out from the body, but we can definitely treat it.
Okay, so basically, melasma, it's the reason of having melasma or its treatment is multidirectional. It affects physical appearance, it affects our psychological well-being, social acceptance, everything. But first thing is acceptance about this condition, and then treating it with proper good advice and proper and perfect medicines or any other sunscreen or moisturizers, everything. This is what
Exactly.
I can conclude.
Exactly.
I would like
Yes.
to ask
Exactly.
you, yes,
Sorry.
please, please.
Basically, we need oral medicines. We need a proper skincare routine. Once you understand the reasons for melasma, we can take care of them better. So, avoid using over-the-counter medicines and take a proper approach from by consulting a dermatologist,
Yes.
whoever you want to.
Can diet play or any food habits, changing any food habits play any role in prevention or decreasing melasma pigmentation?
Yeah, foods which have a lot of antioxidants in it, like vitamin C rich foods, they can definitely decrease melasma.
Mhm.
So eating a lot of berries, amla, will
Right. So winter season is
definitely.
here, so we can
Yes,
surely have amla.
yes, definitely. Amla juice daily morning in lukewarm water, not the syrup, but the juice
Okay.
will definitely help.
Okay. So vitamin C, I guess it's very important for our skin overall skin health, because vitamin C in all sense help us in many other skin problems. From acne or wrinkles to melasma also.
True, true. Vitamin C is a very good antioxidant. So, yeah, it helps
Uh,
for many things.
I would like to ask you that you have a very long career, over 18 years of your professional career. Can you share any of your incidents with treatment of any patient having melasma or any pigmentation, which is, very close to your heart or difficult to treat or very special to you?
Mhm. I remember once in the OPD there was one patient who had melasma all over her face, and she was very emotionally disturbed. She came to me saying, "Doctor, आप मेरा plastic surgery करा दो. आप मुझे नहीं चाहिए ये face." I am feeling very depressed because of this. So I told her, counseled her that plastic surgery is not the option. So we will do the treatments. So I did that platelet-rich plasma therapy in her, and it decreased quite a lot. Her melasma decreased a lot. So PRP therapy is one of the new options which have come in. And since she had used all other topical creams, and she had taken oral tablets before she came to me, I gave her this option. And she religiously did it, and she could see a decrease in her pigmentation. So she was very happy. So, seeing a person happy, the happy smile on her face really made my day much more brighter.
Wow.
So,
Yeah.
mhm.
So, before we conclude today's session, any take home or closing remarks for our viewers for not just melasma but overall skin health and overall well being?
Okay. Yes. Um, Basically, first is eat healthy food, eat food rich in antioxidants, have a lot of fresh fruits in your diet, avoid junk food to the minimum. Definitely, you can eat junk food on a Saturday or a Sunday, but during the week, eat healthy food, um, eat a very well balanced diet, and drink a lot of water. Keep yourself hydrated. Um, Also, have a good skincare routine. Go once to a dermatologist, get your skin checked, and she or he will prescribe you a proper skincare routine based on your skin type. So, a good face wash, moisturizer, and sunscreen. That is the bare minimum. Now, if you have any skin conditions, then accordingly, serum can be added or other creams can be added, but using a sunscreen is very, very, very important. And based on your skin type, a sunscreen will be prescribed to you. um, and and mm, Stay happy.
Yes, that's the most important thing these days.
Yes. Mhm.
Yes, because we are surrounded by physical stress, mental stress, and all kind of stress, and that is the emerging reason for any problems ranging from common cold to cancer also. So I guess
True.
this is viewers, this is the most important thing, that we stay healthy, we stay happy from within. So I guess our skin will glow from within if we stay happy and healthy from within.
Right.
Right.
Very
And
true.
skin, I guess skin being the largest organ of our body, because we shouldn't forget that skin is also one of our organs, and it covers the entire body. So it is the largest organ of our body. So we have to take care of our skin. And this is the closing advice from Dr. Malini. Doctor, thank you so much for your valuable time. It has been really a very informative session for me and as well as for all our viewers. And it is great to hear from you. Thank you so much for taking time and joining with us.
Thank you so much. Thank you. Thank you, everyone, for taking out time from your routine to listen to me. Thank
Thank
you.
you. We really look forward for many such sessions for our viewers in coming time as well. And also thank you viewers for participation in today's live session. I hope today's session is as informative and it will help you so much in managing melasma or hyperpigmentation or any other skin conditions if you are having or one any of your family members friends are having. So do spread the word, and as ma'am said, stay happy, stay healthy, and take care of your skin, and stay connected to our page Beautiful Spotless Skin. We will be back with some more information and more expert doctors to talk about many other things, and we will meet very soon. Till then, take care. Goodbye.
Good.